Sanjana, should I be recording the meeting? Okay, okay. Join, shall we begin? Yes, last time we did sensory systems. Okay, let me quickly share my screen. All right, how are we doing? Today is the last class of biopsych. And like I had mentioned last time, we will be covering an overview of the endocrine system. Have we started recording? Okay, okay, great. All right. Okay. Fine. So the reason why I wanted to cover endocrine system is because we are studying biopsychology. So we need to know what role hormones play. Very brief overview. There are a lot of things to be covered within the endocrine system also. We have not covered neurotransmitters as well because of lack of time. Obviously, we'll go into depth once we begin the advanced series. But as of now, we are going to do a very, very brief overview. But stay with me, okay? It is going to be uh, very jargon heavy, and you might be reminded of your science biology classes from school, okay? Because you will see the diagrams and you will really think that you are in school today. Okay, so let's begin. But first, you know the drill. We will start with the MCQs first, and we'll try to understand how much we know, okay, so far. Fine. Which gland is located at the base of the brain and is often called a master gland? Yes, correct. Very good. Next, which of the following endocrine glands has direct influence on circadian rhythms via melatonin secretion? Yes, correct. It is B, pineal gland. Very good. Next, during the stress response, which of the following sequences accurately represents the order of glandular activation in the HPA axis? Correct. It's C, hypothalamus, pituitary, adrenal. I mean, obviously, because it is HPA. Yeah, correct. Next. Which gland is located above the kidneys and plays a role in the flight or fight response? Yes, adrenal gland. Perfect. All right. So, most of us, I think, know what hormones are. And most of you, I mean, all of you got the MCQs right. So, okay, let's begin. Yeah, sure. Hey, wait, there's one more MCQ left. Sorry. Which of the following substances can act both as a hormone and a neurotransmitter depending on context? What do you think it is? Think. No, the answer is C, oxytocin. And I'll explain in the class why it is oxytocin. Okay, fine. So let's begin. What is endocrine system in the first place? Okay, now I'm going to not look at the chat box. So whatever doubts you have, you can ask me once the class gets over. Cool? Give me a thumbs up. Yeah, all right. Chalo, let's begin. Yeah. Okay, so what is an endocrine system? Basically, it is a network of ductless glands that secrete hormones into the bloodstream, right? See, the endocrine system is one of the two long distance communication systems in the body. Okay, sorry. What is happening? Just a minute. Hmm. Long distance communicating systems. Okay, and there are only two such systems in our body. First is your nervous system, and second is your endocrine system. Okay. Now, it is very important for us to understand the nervous system versus the endocrine system. The reason why I want to highlight this is because in a lot of interviews that I've taken, literally master's level interviews, people are getting confused between neurotransmitters and hormones. And that is scary. ठीक है इतना बेसिक तो हमें पता होना ही चाहिए so let's quickly understand what nervous system does and what endocrine system does. See, nervous system conducts electrical signals throughout the body And how does it do that? With the help of neurons, correct? Like Nora the Explorer. And neurotransmitters होते हैं. Neurotransmitters are what? Chemical messengers which are released from the neurons. Correct? Now, when you talk about the endocrine system, in contrast to the nervous system, it conducts chemical signals throughout the body via glands. Okay. Nervous system में क्या हो रहा था? Electrical signals are passed throughout the body with neurons. Endocrine system में क्या हो रहा है? It is conducting chemical signals throughout the body via glands. Okay. So the chemical messengers are released by these endocrine glands, which are called hormones, and they travel throughout your bloodstream. Okay. Now, what happens is that when they're traveling through the bloodstream, they are going to go to these specific target cells, okay, that have receptors for those particular hormones only. Now, this entire system, this entire communication usually occurs within seconds. However, it is still like in comparison to how the nervous system works, we still consider this communication to be a little slower. Okay? Why? Because these signals often linger for a very long time, and they are quite expansive in terms of what kind of effects they are going to have on various tissues, right? So hormones are always going to have a broader effect. Okay. Now, why is this system effective? Because hormones which are in the bloodstream, they can be delivered almost anywhere, right? The only way, however, any tissue will respond to a hormone is if they have sufficient receptors for that signal. So it is very much like a lock and key thing. Okay. So I'll explain it in more detail. See, hormones are going to be selective. Okay. Like I said, they only affect specific cells. Okay, and these specific cells are called target cells. Okay, these target cells are going to have special receptors for only that particular hormone. Okay, so like I said, lock-in key jaisa hoga. Key is your hormone, and your specific lock is going to be your receptor. Okay, so what happens when a hormone binds to its target cell? See, first the hormone is going to find the right receptor. And once the right receptor is found, it is going to send signal inside that particular cell. Okay. Now, the signal basically tells the cell what to do. So that would be to make a protein. It could be to use or store energy. It could be, to release any other substance, right? And because only some cells have the right receptors, so if that particular cell doesn't have receptor for that particular hormone, the hormone passes by. It is not going to affect that cell at all. Okay. Now, when we talk about glands are located, are spread throughout your body, right? So if you look at this particular diagram here, right here, endocrine glands are spread throughout the body. So you see pituitary gland, which is in the brain. You see thyroid gland here, which is in the neck. You will see adrenal glands, right, which are on top of the kidneys. Then you have your pancreas, okay, which is right behind your stomach. Then you have ovaries and you have testes, right, which are in your pelvic region. So all of these, like all of these different hormones get released depending on what the body needs, right? So what we basically need to remember is that hormones are chemical messengers, A. Second, they are released into the bloodstream by endocrine glands. and they travel through the blood to reach target cells. They only work on cells which have the right kind of receptors, and the trigger is going to change inside the target cell depending on what the body needs. Okay. So this is a basic overview of what the endocrine system is all about. Okay. Now, till here, do we have any doubts? Like, this is some basic understanding that all of us have. Yes. Okay. Fine. So now let's go into a little bit of detail. And this is important again because as psychology students, we are not taught this, unfortunately. That is why I've added this in the slide. We need to have some idea about the classification of hormones also. Okay? Because a lot of times when questions come for NET or for MPhil also, match the following and stuff. At that times, they might use these words, lipid soluble, peptide, amine. So we need to be acquainted with these terms. Okay. So not all hormones are alike. They are going to be made of some different kind of substances, right? So this is a very, there are different ways in which hormones can be classified. If you look at it from a physiology perspective, it is going to be different. If you go, there are many classification systems, but we are going to stick to this. Okay? So there are three types: lipid soluble hormones, peptide hormones, and amine hormones. Now, quickly to understand what these are. These lipid ones are nothing but steroid hormones. Okay? They are basically cholesterol derived. ठीक है? तो इसके examples क्या होंगे? Your cortisol, your estrogen, testosterone, right? All of these are lipid soluble hormones. ठीक है? Now, where is their implication when it comes to reproduction, your mood, your stress, right? So these are lipid soluble hormones. Second, we have peptide hormones. Now, peptide hormones are nothing but chains of amino acids. Okay. इसके examples होंगे oxytocin, insulin. You might have heard about the growth hormone. So GH, that is also a peptide-based hormone. Basically, when it comes to your hunger, when it comes to growth, when it comes to social bonding, right? These are the implications. So these are peptide hormones. And then you have amine hormones. So these are nothing but modified amino acids. Again, all of this is chemistry. We don't need to really go into the structure of these. You just need to have this basic understanding. ठीक है? Modified amino acids के क्या examples होंगे? We have melatonin. We have epinephrine. Yes. We have thyroxine. I'll just write it here. Thyroxine. These are basically your modified amino acids. ठीक है? So ये basic classification है of hormones: lipid soluble, peptide, and amine. Clear? Yes. Okay. Now, moving on. Now, again, I've added principles of hormonal influence. There is, again, another reason being because in psychology, we are never really taught that. Hamesha, when we study the endocrine system, if you go into like basic introductory psychology textbooks also, they'll just give you an overview of the 7 glands and what they do. But no one goes into the details of hormones per se. So that is why I have added things which I'm sure you may have not studied before. Okay. And brief overview I've given in the following slides. But this is something which is important, and I really think you should make a note of it in your notebooks. Okay, fine. So the basic principles are: first, hormones influence probability of behavior and not direct causation. Okay. Second, context is going to matter. Third, bidirectional feedback. ठीक है? Behavior changes hormones. Hormones alter brain plasticity. And fourth, hormones affect neural substrates. ठीक है? Now let's go by like each principle one by one. So when I say hormones influence probability of behavior and not direct causation, what does it mean? Hormones never directly cause behavior, okay, in a very deterministic sense. Instead, what they are going to do is they are going to modulate the likelihood that a certain behavior will occur or not in a particular situation or in a given context. For example, when we say testosterone, testosterone doesn't cause aggression. Rather, it increases the probability of aggressive behavior when provoked or when challenged, especially when you are in a threatening situation. But it doesn't cause aggression. Are you getting it? So hormones do not directly cause behavior. They're just going to modulate the likelihood whether a certain behavior will occur or not, given the context. Okay? So that was our first principle. Hormones influence probability of behavior and not direct causation. Second, context. Now, context is very, very critical because the same hormone can produce various effects depending on the social, environmental, or internal context, right? So, for example, when you think of testosterone only, for that matter, when you think of competitive situations like sports, for example, you will see some rise in testosterone, right? However, uh, when you think of fatherhood, for example, at that time, a more nurturing behavior is going to be prioritized, right? So, context is very critical. Then, third principle was about bidirectional feedback loops. That means the relationship between hormones, sorry, yeah, the relationship between hormones and behavior is going to be a two-way thing. Hormones influence behavior, but behavior can also change hormone levels, right? For example, when you are experiencing chronic stress, it can raise your cortisol levels, right? Now, this in turn can influence future stress reactivity also, right? So, this bidirectional relationship is something that we need to keep in mind. Then comes our fourth principle, which is hormones affect neural substrates. So, basically, hormones don't influence simply momentary behavior. Okay. They affect a lot of things. They can affect neurogenesis. They can affect synaptic plasticity. They can affect receptor sensitivity, right? So the effects of hormones are going to be long term and they have the ability to alter your brain structure and the function. Okay. So these were the four things that we need to keep in mind. Yes. Are we clear about this? Yes. Okay. Now, okay, someone is asking, what are neural substrates? Substrates are basically, it is a very biological term. It basically refers to specific brain structures or networks or circuits. Okay. So it is just any anatomical or any functional part of the nervous system which sort of plays a role in any kind of behavior, any kind of cognitive process, or any kind of emotional response is called a neural substrate. It is just jargon. Okay. The fourth one. Yeah, I'm just saying that. Okay. So wait, there's one more question. Uh, in the point about context, do we mean that same hormone is manifested differently? Okay, I'll talk about Chaitali. I'll take your doubt later. First, I'll explain the fourth point. Right? Okay. So, just a minute. Yeah. When you talk about uh, any kind of neural structure, right? It is going to get impacted by hormones. Okay. So you need to be able to connect the hormones and what kind of impact they are going to have on these. So, for example, when you think of cortisol, okay, cortisol is released as a stress response, right? So, what are the kind of neural substrates, as in what are the kind of areas which are implicated when you talk about cortisol? Hippocampus, your amygdala, right? Then when you talk about, let's say, estrogen. Now, estrogen is it has all apart from the reproduction part, it also has to do with your mood. It also has to do with your cognition. So, uh, there is going to be some impact on your prefrontal cortex as well, right? So, basically, uh, these are the neural substrates are the regions through which hormones shape behavior. Are you getting it? Is the fourth point clear? Is this clear that how hormones affect neural substrates? Yes? Okay. Yeah. So, like I said, hormones modulate the activity, hormones rewire the function also, right? Because when you think of cortisol, like I said, it binds to the certain receptors in your hippocampus, right? When you think of oxytocin, if your amygdala thinks ki, oh, there is some kind of social threat, your oxytocin is going to dampen that amygdala reactivity, right? Why? Because oxytocin promotes trust, it promotes bonding, it promotes empathy, right? So it is going to dampen your amygdala reactivity depending on the context. Are you clear with this? All right, fine. Okay. Chaitanya, do you think this also helped answer your question? Same hormone manifested differently? Okay. Okay. Fine. So, exactly. So, when we talk about context dependence, the only thing that you need to remember is hormones, they are not deterministic in nature, they just modulate. So, depending on the social context, depending on what kind of history you've had, depending on, the timing, the hormones will act differently. ठीक है तो अगर तुम काफी सेफ ट्रस्टिंग एनवायरमेंट्स में हो तो ऑक्सीटोसिन इज गोइंग टू प्रमोट बॉन्डिंग इट इज गोइंग टू promote pro-social behavior. However, let's say you've studied social psychology, I'm sure. So when you think of competitive settings or when you think of threatening situations जहाँ पे अलग अलग ग्रुप्स है, so what will oxytocin do? It will help increase in group favoritism, right? So that is how oxytocin will react differently, will act differently depending on the context. Okay, fine. Now, moving ahead. Yeah. Now let's quickly have an overview of the major glands in your body. Okay. Uh, First, we obviously talk about the hypothalamus. Now, hypothalamus, which is located right here, it is very small. but it is incredibly mighty. Why? Because it integrates external stimuli ka cues with your internal states. Internal states like your hunger, your hormone levels. Yes. Do we remember what we studied about hypothalamus in our last class? Last to last class, sorry. What did we talk about? Yes, yes. We spoke about VH. We also spoke about, yes, hunger and satiety. Correct, correct. We spoke about ventromedial hypothalamus. We spoke about lateral hypothalamus, which has to do with hunger. Yes, anterior hypothalamus. Yes, so we've already covered that. So we understand what we mean, what I mean when we say integration of external stimuli with the internal states, right? Also, it initiates all the endocrine system activity through releasing hormones. Okay. Now, your hypothalamus becomes very, very critical when it comes to motivation, when it comes to your sexual behavior, when it comes to your aggression, sexual behavior, because remember we spoke about anterior hypothalamus. So, basically, your hypothalamus is like your psychological thermostat. It is going to detect what is off and it is going to begin to restore balance depending on what is required. Okay? That is the basic function of hypothalamus. Again, I am briefly touching upon this. There is a lot more that we need to study here. But again, just a quick overview. Okay. Then we move to pituitary gland. Now, pituitary gland, like I said, uh, when you think of, okay, you look at the diagram here. So pituitary gland is right below your hypothalamus. Okay. Now, what does it do? You all must have studied this, right? Can anyone quickly tell me uh, about pituitary gland, if at all you remember anything in the chat box? Mm-hmm. Yes, master gland. Yes, yes, correct. See, pituitary gland is again very, very small. It is like pea-sized structure which is located just below the hypothalamus, and hypothalamus and pituitary gland are connected to each other with something known as infundibulum, which is nothing but in like normal terms pituitary stalk. Okay. Now, uh, it is called the master gland because it secretes hormones that regulate most of other endocrine glands. Okay. Uh, Again, we are not going to go too much into detail here. But remember that when we talk about pituitary gland, there are certain anatomical divisions of it. Okay? There is going to be anterior pituitary. Then you're going to be having your posterior pituitary gland, right? So again, depending on like which pituitary gland we're talking about, the kind of hormone that is going to be released is going to be different. So when we talk about the anterior pituitary gland, hormones like your ACTH, okay, ACTH का target होता है adrenal cortex. So whenever there is some kind of stressful situation, it is going to stimulate cortical release, okay, as a stress response. Then when you talk about growth hormone, GH, that also comes under your anterior pituitary. ठीक है, तो एंटीरियर पिट्यूटरी क्या करेगा? ग्रोथ हार्मोन, टारगेट ऑर्गन कौन सा है? लिवर एंड बॉडी सेल्स. एंड व्हाट इज द फंक्शन ऑफ इट? ग्रोथ, रिपेयर, मेटाबॉलिज्म, राइट? देन व्हेन यू थिंक ऑफ टीएसएच व्हिच इज जिसका टारगेट होता है थायराइड, it is going to stimulate your T3, T4 release, right? Which is important for metabolism. So all of that comes under anterior pituitary. Again, to summarize, the hormones which I mentioned were ACTH, TSH, and GH, which is a growth hormone. Okay. And then when you talk about your posterior pituitary, again, remember it does not produce hormones in itself. Uh, the posterior pituitary is going to store and release two hormones which are made by the hypothalamus. Okay. So when you think of oxytocin, please excuse the spelling, I am writing in a hurry. When you think of oxytocin, तो जब यूटेरिन कॉन्ट्रैक्शंस होते हैं या व्हेन मिल्क इजेक्शन इन अ मदर, और अगेन लाइक आई सेड सोशल बॉन्डिंग, ट्रस्ट, सो ऑक्सीटोसिन यहाँ पे काम आता है. तो posterior pituitary is going to store and release the oxytocin whenever required. Then when you think of there is something known as the vasopressin hormone. Okay. Vasopressin is the hormone which regulates water balance by acting on kidneys. It also has some implication when you talk about social behavior and when you talk about aggression. So basically your oxytocin and your vasopressin are two hormones which are going to be stored and released by the hypothalamus as and when required. Okay? Now, remember I told you how oxytocin uh, can be a neurotransmitter also, and it is a hormone also, right? So depending on where and how it is acting, oxytocin will take up different roles. So when you think of oxytocin as a hormone, it is going to be produced by the hypothalamus. And how is it going to get released into the bloodstream? Via the posterior pituitary, which I just explained. So then it is going to act on your uterus, your mammary glands, and other body tissues, right? So when it is circulating in the bloodstream, oxytocin has a hormonal role. However, when uh, oxytocin gets released directly into the brain from the hypothalamic neurons, in that case, it is going to act as a neurotransmitter, or it is going to act as a neuromodulator, right? So what it does, it binds to oxytocin receptors in your neural circuits. For example, it may bind to amygdala, emotion, fear modulation के लिए. It might bind to your prefrontal cortex for empathy, social cognition, right? So when it is released in synaptic clefts, it acts like a neurotransmitter. Okay. So moral of the story, oxytocin is both a hormone and a neurotransmitter. It is going to act hormonally when it is released into the bloodstream by the posterior pituitary. And it is going to act as a neuromodulator within the brain when it is released in the synaptic cleft. Okay. Are we clear? Are we clear with this? All right. Now, moving ahead. That's all that we're going to talk about pituitary. Again, like I said, because we're running short of time. Then we have adrenal glands. Now, very, very important thing that you need to remember is two terms: adrenal cortex, adrenal medulla. Okay? A lot of times we get confused between the two. Now, we should also know this: when you talk about cortex, it is going to be gray in color. ठीक है, तो cortex मतलब बाहर का, because cortex also means bark. So cortex is the outer layer and medulla is inside. Okay, and adrenal glands sit right above your kidney. Okay, here. So why is this classification important? Adrenal cortex and adrenal medulla. Because when you talk about adrenal cortex, we speak of two hormones: cortisol and aldosterone. Okay. When we talk about medulla, there are two other hormones. You have your epinephrine and you have norepinephrine. Okay. Now, what does cortisol do? Cortisol enhances your alertness. It also enhances your memory encoding. Okay, short term, of course, not long term, but that, right? अगर cortisol बहुत time के लिए activated रहता है, because your body thinks that it is under stress, because our sympathetic nervous system a lot of times doesn't understand if the threat is real threat or if it is a perceived threat. So if it perceives threat for a very long time, there is going to be a chronic elevation in your cortisol. And if that keeps happening, you know what will happen? Eventually, your hippocampus is going to shrink and your prefrontal cortex, it's going to start dysfunctioning. तुम्हारे इमोशनल रेगुलेशन में भी इशू होगा. ठीक है, so that is what you need to keep in mind. And when you talk about epinephrine and norepinephrine, basically they are implied in your fight or flight responses. They heighten your arousal, they heighten your vigilance. They're also going to understand the difference between, like help you understand the difference between tones. कि sympathetic tone था क्या, etc. ठीक है? We will talk a little more about this when I am teaching you the HPA axis, which is in just a few minutes. Okay, so that's about adrenal glands. Then we have gonads. Gonads are nothing but your testes and ovaries. Yeah, so they are going to be a part of your reproductive behavior axis, right? So when you talk about testosterone, it is usually linked with dominance, it is usually linked with risk taking, sexual motivation. Then when you talk about estrogen, right? Estrogen is also very important when it comes to mood, right? Then we have progesterone. Okay. It has a lot of impact on emotion regulation, especially when it comes to you know, anxiety evoking situations, right? Now, it is said that gender differences in behavior may arise because of these organizational effects, as in early development में these hormones, the way they act, they are activational effects basically during puberty or menstrual cycle. All of these, right, can affect behavior. Okay, rather than just pure socialization factors due to which gender differences occur, sex hormones are also one of the important aspects of it. Okay, then we have our pineal gland. Very, very important. Pineal gland secretes. Now you tell me, I'm opening the chat box for a minute. Does it secrete melanin or does it secrete melatonin? Correct. What is melanin? Can anyone tell me? What is melanin? Have you heard about it? See, a lot of times melanin and melatonin are often confused. Understand that melanin is a pigment. It gives color to your skin, your hair, your eyes. Okay, it is not a hormone. Please keep this in mind. Okay, so melanin and melatonin are not the same. Melatonin is produced by pineal gland and it is a hormone which has to do with your sleep-wake cycle. Okay, your circadian rhythm. Okay, and it is triggered by darkness. Okay, now when you talk about pineal gland, very, very important role in regulating sleep-wake cycle. Okay, in fact, you might have heard of melatonin-inducing pills, right? They are not sleeping pills per se. What their role is to just help your brain understand कि अच्छा अभी melatonin release करना है, ठीक है? So what does melatonin do? Like I said, your melatonin is triggered by darkness. So the secretion by the pineal gland is going to be triggered by darkness. And It is inhibited by light. That is why usually when we talk about sleep hygiene, psychiatrists, psychologists usually see this कि screen exposure तुम बंद करो, बहुत bright areas में मत रहो. If you are planning to sleep, make sure that the room is dimly lit और अंधेरा करके बस सोने का try करो, because when darkness is there around you, it is going to trigger your melatonin hormone. Okay, fine. Now, हाँ, someone asked aldosterone क्या करता है? एक मिनट. We were talking about adrenal glands, right? So, when you talk about the cortex, apart from cortisol, aldosterone is the second thing. So, aldosterone is basically your salt and water regulator. That is why I didn't mention it for the stress thing. Okay. So, aldosterone is your steroid hormone, and basically it increases your sodium reabsorption. Okay. And it increases your potassium excretion. Okay. But it doesn't really, it's not as relevant when we talk about our stress reactions. Okay. Okay. Now moving on. Pineal gland is done. Then we come to thyroid and parathyroid. So again, there is something known as T3, T4. You might have heard about these terms when your general physician asks you to get these tests done, right? कि thyroid check करवाओ, T3, T4 check करवाओ, right? So again, the reason why understanding this is important, because a lot of times when there is hyperthyroid or when there is hypothyroid, they can mimic certain symptoms which we usually experience if one has depression or when one has mania. ठीक है? तो T4 is basically your thyroxine hormone. Okay. Again, these names T3, T4 ही usually बोलते हैं. These names are very huge names. Again, as psychology students, you're not supposed to remember that. ठीक है? Now, when you talk about hypothyroid, okay, it sort of mimics symptoms of depression. That is why a lot of times, let's say when you approach a psychiatrist, the first thing they ask you to do is to do blood work. They'll ask you about lifestyle diseases. Do you have diabetes? Do you have hypertension? If you've not checked, then the first thing that they ask you to do is get thyroid checkup done. Okay, because hypothyroid, matlab when your thyroid gland produces insufficient T3 or T4, what it is going to do is that it is going to slow down your metabolism. Okay, now it also slows down certain processes in your central nervous system. So, agar low T3 hai, low T4 hai, so the kind of glucose utilization that your cerebral cortex does, because glucose is the primary food of your brain, तो उसका low glucose utilization होगा, which leads to slow cognitive processing, which is going to lead to mental fog, which is going to lead to fatigue, right? Your hypothyroidism is also going to cause anhedonia. Anhedonia मतलब previously pleasurable things जो थी अभी मुझे उसमें interest नहीं आता. That is anhedonia, right? Hypothyroid can also lead to anhedonia. It can also lead to low mood, also reduced motivation, right? तो ये सब चीजें ना दिखने में एज अ साइकोलॉजिस्ट यू माइट थिंक ओ दीज आर टेक्स्ट बुक सिम्टम्स ऑफ डिप्रेशन, इसको डिप्रेशन होगा एंड द साइकाइट्रिस्ट, इफ साइकाइट्रिस्ट इज नोवाइस, this person will like, okay, let's prescribe depression medicines. No, you first get thyroid checkup done, and then if all of the blood work comes normal, then you go ahead with your psychiatric medications, psychotropic medications. Fine. So yeah, that's mainly what you need to remember about the thyroid and the parathyroid thing, that it is going to regulate your basal metabolic rate. It has to do with your energy, and it also has to do with your mood. Okay. Now, your PTH, which is your parathyroid hormone, it maintains your calcium balance, okay? And it is also going to affect neurotransmission in some or the other way, okay? So that's about thyroid and parathyroid. Then the last gland that we'll talk about is pancreas. Main role इसका है in terms of insulin and glucagon. Okay, you may have heard about these terms when it comes to blood sugar regulation. ठीक है, अगर इसमें अगर कुछ इशू होता है तो it is going to lead to mood instability, it is going to lead to irritability, again it is going to lead to fatigue, right? So again, checking this is important because a lot of times what you are feeling may not be purely emotional, but it might have a very strong neuroendocrine origin. Okay, so that is pancreas, what you need to remember. So that was a very quick overview of your endocrine system. We spoke about the pineal gland, we spoke about hypothalamus, pituitary gland, thyroid, pancreas, adrenal glands, right? And we spoke about ovaries, we spoke about the testes. Yes. Now you will see there's a very interesting thing mentioned here in the diagram. It is also mentioned under the endocrine system. Can anyone tell me why is it written here? Any idea? Did you know this? Can anyone tell me? Yeah, placenta. Okay, I'll tell you one interesting fact now. In early, when you are inside your mother's womb, the placenta functions as a temporary endocrine gland. Okay, it is going to produce and secrete hormones directly into the mother's and the fetus's bloodstream. There is no duct. Okay, and that is why it is mentioned here. Okay, during pregnancy, the placenta acts like a temporary endocrine gland. Okay, so keep that in mind. Okay, moving on. Huh. What is in the brackets? Pancreas. Uh, it is just again another jargon, islets of Langerhans. So you like again, I've mentioned it here just for you to remember this from the exam point of view. क्योंकि a lot of times they won't mention the word pancreas, but they'll just mention this. Okay, these are basically nothing but the clusters of endocrine cells which are scattered throughout your pancreas. Okay, so they islets are the one which constitute the hormone secreting part. Okay, Langerhans was nothing but this pathologist, some pathologist. So they are named after that person. So they are vital for your blood glucose regulation. Okay, now, so yeah, that's about that. Now, quickly walking you through the HPA axis. I'm sure a lot of you must have studied this in your first year of college, like junior college, not junior college, sorry, bachelor's. So the HPA axis, like the word suggests, it stands for your hypothalamus, pituitary gland, and adrenal gland ka system. Okay? It is a neuroendocrine system, and its primary role is to respond to stress. Okay. Now, what it does is it is like it is central to your stress response system. So it's like when your body perceives stress, your hypothalamus is going to secrete something known as the corticotropin releasing hormone, which is CRH. Okay. जैसे ही स्ट्रेस हम डिटेक्ट करते हैं, hypothalamus first releases CRH. Then it signals your pituitary gland. What does your pituitary gland do? It is now going to secrete ACTH. ACTH is nothing but adrenocorticotropic hormone. Okay. Now, once pituitary gland secretes ACTH, it is going to travel through the bloodstream and it is going to go to your adrenal cortex. Remember I told you adrenal cortex, adrenal medulla. तो अभी हम adrenal cortex के बारे में बात करें. Cortex के दो hormones थे, cortisol, correct? So cortisol here, मतलब in HPA axis, cortisol is going to play the primary role. So your ACTH is going to travel all the way to your adrenal cortex, which is then going to release cortisol, which is your primary stress hormone. Okay. So what does cortisol do? Cortisol helps the body manage stress by increasing energy availability. Okay, and it is going to start suppressing non-essential functions. So एक बार cortisol levels are high enough, उसके बाद they are going to send a negative feedback to the hypothalamus. They are going to send a negative feedback to the pituitary. Negative feedback matlab it is going to tell the hypothalamus and pituitary, okay guys, now you can, back off. I have things under control. So now you can reduce your CRH and now you're going to you can reduce your ACTH. Okay, and then it sort of ends the response. Okay, so the primary thing is that is going to link the brain and the body, and your HPA axis plays a very important role when it comes to your mood, your memory, your emotion regulation, right? And you have to keep in mind कि अगर chronic activation रहा तो it can lead to anxiety, right? It can lead to cognitive issues. Okay, so that's all about the HPA axis. Fine. So with this, we sort of come to the end of the class. We again very briefly covered the endocrine system. I'll just quickly walk you through this like a revision of sorts because starting में हमने जो किया was very new to us. So basically what we spoke about is how the endocrine system works differently than the nervous system. I said that nervous system and endocrine system are the only two long distance communication systems in our body. And we spoke about how neurons communicate and how the neurotransmitters are the main thing. Whereas when you talk about endocrine glands, we speak about the chemical signals and we speak about how the hormones have a long lasting impact and how they have a broader effect, right? Then we spoke about the classification of hormones, lipid soluble, peptide, and amine, right? Then we spoke about the principles, four major principles. Hormones influence probability of behavior, not the behavior itself. So there is no direct causation per se. Context is always going to matter. Then there is going to be a bidirectional feedback. That is, behavior changes hormones, but hormones can also alter brain plasticity. जैसे मैंने बोला, oxytocin is going to dampen your amygdala's response if there is no threat, right? Then hormones affect neural substrates. Neural substrates are nothing but different kinds of areas in your brain. So hippocampus, amygdala, hypothalamus, etc. Right? Then we spoke about the major glands. We walked through hypothalamus, pituitary gland, adrenal gland, gonads, pineal gland, thyroid, parathyroid, and pancreas. Okay. And then we have the HPA axis. Yeah. Noor, what do you want me to repeat? What last part? What last part are you referring to? The HPA axis? You want me to elaborate on that? All right. After cortisol helps managing stress. Ha. Okay. So I said that once the cortisol is released, once the cortisol levels are high enough, they are going to send negative feedback. Negative feedback means when you want to increase something. Negative feedback means when you want to reduce something, like in biopsychology terms. So when the cortisol levels are high enough, they're going to send a negative feedback to both the hypothalamus and your pituitary. Okay, pituitary. Understand the spelling now. Okay. So what negative feedback? It is going to tell the hypothalamus and pituitary कि भाई लोग अभी तुम लोग थोड़ा back out कर सकते हो. Things are under control. You can reduce CRH, which is your corticotropin releasing hormone, and your ACTH, which is adrenocorticotropic hormone. Okay, which your pituitary gland releases. That's what I said. That was the last part. Okay, cool. All right, fine. Okay, then let's quickly end our lecture with our MCQs as usual. Let's do this. Okay, someone is asking vasopressin and somatostatin. Ha. Okay, so vasopressin, sorry, is your antidiuretic hormone. Uh, it is basically produced by our hypothalamus, like I had mentioned earlier. It is stored and released by our posterior pituitary. तो उसका primary physiological function ये है to regulate water balance. It is also going to help increase water reabsorption in your kidneys. ठीक है? It sort of maintains blood pressure via vasoconstriction. ठीक है? Now when you talk about somatostatin, it is nothing but your growth hormone inhibiting it is growth hormone inhibiting hormone. So it is GHIH. जैसे हमने growth hormone के बारे में बात की थी, GH. Somatostatin is your somatostatin is going to be our growth hormone inhibiting hormone that is also produced by our hypothalamus. It is also actually produced by delta cells which are in your pancreas. ठीक है? थोड़े अलग साइट्स भी है जैसे और गैस्ट्रोइंटेस्टाइनल ट्रैक्ट also releases some of it. उसका मेन फंक्शन होता है टू इनहिबिट ग्रोथ हार्मोन. ठीक है? ग्रोथ हार्मोन, रिमेंबर आई टोल्ड यू अबाउट एंटीरियर पिट्यूटरी that releases growth hormone, right? Secretes growth hormone. So a primary function of GHIH is going to inhibit the GH. Okay. It is also going to inhibit the release of insulin and glucagon up to certain extent. उसका job होता है to slow down digestion, to slow down nutrient absorption. ठीक है? So yeah. A lot of times when your somatostatin is less, reduced levels है, तो मतलब they have been implicated in depression also. Okay. I hope this answers your question. Inhibits growth मतलब not growth, मतलब growth hormone को inhibit करता है. ठीक है? All right. Fine. Now let's go ahead with the MCQs. I don't want to take a lot of time. Quickly, which of the following best distinguishes hormonal from neurotransmitter communication? Quickly. The answer is C. Hormones affect distant targets over time via the bloodstream. ठीक है? Next. Which hormone increases during stress and helps mobilize energy? This is very easy. Come on. Yes, cortisol. Perfect. Next. Which hormone released by the adrenal medulla prepares the body for sudden arousal and alertness? Correct. Perfect. Epinephrine. Next, which of the following accurately describes the behavioral consequences of hypothyroidism? Perfect. Reduced metabolic rate, fatigue. Correct. Option C. Next, which hormone is secreted by the pineal gland and regulates circadian rhythm? Correct. Melatonin. Perfect. All right. So with this, we finish our lecture today. And I had a lot of fun teaching your class. And I'm assuming I will be seeing you all in further lectures as well. All right. Fine. I'm sorry I took a lot of time, Rutuja. Y'all can take a 2-minute break, I guess. Yeah. All right. See you. Bye-bye. Have fun. I'm glad you're liking neuropsychology. Okay. Chalo. Bye-bye.
Hi guys, we can start at like it's 7:07. Maybe we can start at 7:10 if that's okay with everyone. Okay. See you in
I'm
three
so sorry I
minutes.
took
It's
7 minutes.
alright. No
Yeah.
worries. That's all right.
All right.
Yeah. So, hi guys, I hope you all are back. Can we start? Can I just, okay. Yes. All right. So, today we are going to do dissociative disorders. Just share my screen. Yeah. All right. So, when we talk about dissociation, right, can you guys quickly tell me, like, what is your understanding of dissociation? One second, I'll join from my phone so that I can read your comments. Just give me 1 second. Yeah. Splitting, usually associated with trauma. Okay, different reality. Disconnect with the reality. Correct. Spacing out for longer duration, cut off between affect and behavior and memory. Okay, yes, yes. That's a good answer. So, dissociation, do you guys think that all of us at some point, for some intensity, like do we experience dissociation in our daily life without like having the disorder? Feeling distance from everything around you? Yes, yes. Yeah. So, dissociation, as a lot of you answered, it is like, it is spacing out. It is when we are maybe, like running on autopilot mode, right? A lot of times, like, because sometimes it's also the routine where, you are just doing things and you might not realize, like, you're on your way back home from college and then, you didn't realize, like, wait, did I like just, travel so much, So sometimes the brain goes on autopilot, maybe because there are a lot of things happening in our lives, and like it's just like it helps to compartmentalize and just keep you functioning. So similarly, one perspective of looking at dissociation or dissociative disorders is definitely that it is like a coping mechanism where once the person gets triggered, it's better to go away from reality, because the reality or what is happening, what I might remember right now, could be very painful. And uh, but isn't that this association? Yeah, so like just pilot. I'm just saying, how like similarly going back to the depression wala example where, like all of us feel sad, but when does it become a disorder? Right? So like dissociation, I'm just saying how these why I keep on, explaining at the beginning of the lecture where, like about dissociation, about like mood disorders, it's just like, how all of these, a lot of these experiences are quite like common and all of us go through it. It's just like the intensity and the duration of it can vary, right? So we can be more accepting of people who might be, struggling with these disorders, right? So just it's just a way to, understand and be more compassionate towards like, other individuals, especially when the ableism is so high with regards to, mental disorders, right? So dissociation, we all experience, from time to time, and it can, like sometimes it's not that intense to be a disorder, but dissociation basically is like, can be a coping mechanism, right? So similarly, let's look at like what are the different types of major dissociative disorders, starting with depersonalization and derealization. So let's look at depersonalization first. As the name suggests, depersonalization, which is it's personal with regards to me, right? So also dissociative disorders come under like, disorders of like perception, where so there's a difference between like, schizophrenia and dissociative disorders. Even in schizophrenia, reality, say you're going like away, right? But here, the reality, like you might not hallucinate, you might not see things which are not there, right? Like in hallucinations, there is no external stimuli, but you will perceive something. Here, reality testing remains in Yeah, I will teach Saku. Please just be thoda patient. We are just starting with the disorders. I will come to DID, right? So here we are first starting with depersonalization and derealization. So here there is gaps in perception where they are like distancing themselves from the reality, but the reality testing might be same. Where they might not hear things which are not there. They might not see things which are like in schizophrenia they might see things which are not there, or they might hear things which are not there. So here am I audible now, guys? I'm so sorry, I'm having some network issues. Okay, great. Just 1 second, I'll join from my phone as well. Okay, yeah, I will share. What was the last thing that you guys could hear? Do you guys remember the last thing that you could hear in the presentation? Depersonalization. Okay. Yeah. Yes, yes. Thank you, Unnati. So the difference here is like, that there is a in schizophrenia and psychosis, there is no external stimuli, but you still perceive some things, right? So there's a reality testing difference in reality testing, but here the reality testing remains intact. It's just that the perception towards, like in deep personalization, the perception towards myself, where I might feel unreal, I might feel okay, I am, like I feel disconnected, I feel distinct from myself, right? Sometimes we feel distant from, let's say we're going through something difficult and we're feeling sad, and we might tend to isolate and we might feel distant from our family members, from our friends, right? So when this happens towards my own self, that is depersonalization. As you can read over here, like experiences of unreality, detachment, or being an outside observer. So like it's like I'm looking at myself, like I am just observing myself. It can be like maybe I'm watching a movie about myself, or it could just be you're feeling numb and you don't feel connected with your body, with your senses, with your thoughts, with your emotions, right? So this disruption is happening in the perception during the present time or the current events, right? Then we go to derealization. Here, the gaps are with regards to the surrounding, gaps with the environment, where, like I might feel detached from the world and I might feel, okay, what is happening, right? Like, I might feel, objects around me are not real. I might feel, it's, like my surroundings are foggy, or there can be visual distortions as well, right? Here again the reality testing remains same, because there are external stimuli which are actually present and you can perceive them. It feels unreal, right? So psychosis means there is no external stimuli and you feel there is still something there. So that's the major difference. Here the external stimuli is there, but it just feels that it feels unreal, right? So the perception, there are gaps in perception. And in depersonalization, it could also, like, a lot of times, the common description that is used is, it feels like you're watching a movie about yourself. It feels like, life is just passing through you and you are just being an observer, right? So depersonalization is when I feel distant, disconnected from myself, and derealization is when I feel distant or disconnected from the world or my surroundings or my environment, right? So I hope that is clear. How does this show up in daily life, or what can be like the clinical presentation of this thing, right? How to figure out, like, a person might be experiencing depersonalization or derealization. They might not have a strong sense of self, right? Because they're always, if for a really long time, if you're always disconnected from yourself, right? Just imagine, like, for, let's say, 6 months, 8 months, sadly, you have not been able to talk to your friends, and you feel disconnected, and then someone says, "Okay, oh, like, what is your friendship like?" Maybe you can explain how your friendship was in past, but right now I don't know what's the definition of a friendship, or, like, what my friends, or like what a relationship is like, right? So that distancing happens. So similarly, if I feel distant from, like, myself or my surroundings, I will not be able to define, like, I will not have a strong sense of self, right? Which will then affect, like, my confidence, my self-esteem. All of those things will be very difficult for me to just go through everyday life. And these during, like, different situations, like, even if I am a very skilled surgeon, for example, and if I end up, let's say some traumatic event happens and my brain is trying to protect me from, like, taking the full blow. So it will try, it might, like, experience, like, I might experience, like, the depersonalization or derealization, and I might not be able to perform the surgery because, cognitively also memory issues will happen, because I'm just trying to, navigate through life and figure out, like, what is happening, right? So that, and then, like, yeah, you can also feel emotionally as well as physically numb. A lot of times, like, even, injuries might not hurt a lot. It's not that, like, if a cut happens, it's not like it will not bleed. It will bleed, but it might not hurt them so much because they're so having, like, an out of body experience, right? So that doesn't mean that the hurt or pain is not happening. It just, they might not be able to cognitively feel, okay, oh, this is what's happening to my body right now, or emotionally, this is what I'm feeling. Then, of course, if this is the situation where, the person is in this very, like, foggy state, very distant from themselves, they're not able to have a relationship with their own self, it will be very difficult to have, like, relationships, social relationships, romantic, platonic relationships, work relationships with other people, because you'll always be a little lost and, just trying to figure out, trying to just get through life, right? So these people can also often talk in a monotonous deadpan manner. So again, deadpan manner has come here as well. So then, you have to really look out, like, is the deadpan manner coming from schizophrenia? So you have to look out for, like, so it's called, like, like, differential diagnosis. Why is it dissociative disorder and not schizophrenia, and not, like, a depressive mood, right? So here you have to look at other things as well. So if you have to make sure, okay, how it is not schizophrenia, you have to ask about hallucinations, if they have any delusions while they are talking to you, right? Like the speech, there will be difference in that. For psychosis or schizophrenia, they'll have word salad, or they'll have some, like, 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 unorganized, like, behavior, where which might not have any reasoning, which might not be here in dissociative disorder. Okay, then that is the difference. And depression also, you can figure out, like, rest, it can be thoda tricky to figure out if it's depression or dissociative disorder. But in depression, they might still have, like, a sense of self, right? They will tell you, okay, I don't feel motivated, I feel hopeless, I feel guilty, right? Those are the major themes of depression. So then, okay, it is not like dissociative disorder. But sometimes comorbidity, right? Sometimes simultaneously, dissociation and depression can also happen, right? So that's why, like, diagnosis may, uh, depending on the kind of treatment, sometimes it can be difficult to distinguish, because sometimes they could be experiencing both as well. Then memory issues, of course, like if you're distant from yourself, like, memory issues about like general things, there could be brain fog that the person might be experiencing, right? So cognitive skills do get like, affected in almost all disorders. Then distorted sense of time. So because they're not in their body, they're not present in their body, they might see and they're looking at themselves or looking at the world from, just an observer or out of my body experience. I might feel that the time is passing by very quickly or the time is passing by quite slowly, right? So that is how like distortion sense of time, where they feel that time is going very slow or time is going really fast, So time is going the way it does, but they might feel that way. So again, like perception gaps are there in perception. Okay? Then feeling disconnected or unreal. So they might feel like, I don't feel like, I feel just very cold, or like I don't feel like, any connection between maybe with others or with myself, or I feel like I'm not real, or like the surroundings feel unreal. Like I know that is a tree, I know that is a car, but it just feels, like fake or unreal, right? So that is how they might describe it. Any doubts still here, guys? Okay. Then let's move to dissociative amnesia, right? Amnesia means like memory loss. And then we have like memory loss, which happens because of dissociation, right? So, an inability to recall important autobiographical information, that is information about oneself, usually because of like a very traumatic or a stressful event that has occurred, right? That is like inconsistent with ordinary forgetting, right? Like we might forget, oh, what did I have like yesterday in the breakfast? That is because we have too many things going on. Exams are going on, assignments are there, maybe, personal issues with your friends or your partners or things like that, right? So we might forget because, we are focusing on more important things, right? But you might not forget, like just because you are going through this, like exam stress and all of those things, unless it is extremely stressful for you, right? If it is at a level where you can handle that stress, right, then you might not forget, like, something from your childhood, or you might not forget your birthday or things like that, right? But if it is something extremely stressful for the person, or they've gone through a really traumatic event, then they might forget like information about themselves. So it can be like, certain childhood level, like, childhood years. There are people who, especially with cases of childhood sexual abuse cases, right, where they might not remember and like a certain chunk of their childhood, right? Like in Freudian theories, right, one of the mechanisms, we block the traumatic information or memory, so that it protects us from the pain that it might cause, right? Although like subconsciously that is always there, but like when it comes to the surface, it might hurt us a lot, right? So this is what dissociative amnesia also does. It is, in a way, trying to protect you. Your brain is trying to protect you from something really stressful, or like some, like very traumatic event, where like if you think about it, it comes to your like, like on the surface level, it might cause a lot of hurt and pain, right? So usually, like there can be like two types, where localized, where not able to recall the traumatic event, so exactly that event. So like, when, for example, when the whole Me Too conversation was happening, right? And then people were like, oh, if it happened like 10 years ago, 14 years ago, why are you bringing it up now? There are a lot of nuances to understand this, where, of course, even processing that, oh, this happened with me, and then, to going to, like to the stage where you can talk to other people about it, it's a really difficult journey, right? And then a lot of times what happens is, a lot of children, sadly, a lot of children do, go through like sexual assault or some kind of, molestation during their childhood. And when they grow up, they might not remember that this has happened, right? Like until, some trigger happens and they might remember it. But a lot of times, like, adults might say, oh, I didn't have any memory of that event happening, which could be the time where the episode or the event of like, assault or molestation, happening. So that is your localized, like it is going at like very niche, like exactly, that is what went wrong. That is what the traumatic thing was. And that is what we try to not remember, right? And this can, um, like like it depends, like it can also, because like certain things related, like for example, how a lot of times, like let's say you wore this one particular perfume during your UG years, and then maybe for whatever reasons you stopped wearing that perfume, and after a few years you smell that perfume and all the memories come back, right? So association, right? So that is why the traumatic event can be like, not able to remember the traumatic event, as well as the things or like events surrounding that event, or things that led to that event, or maybe the person who's associated with it, or their behavior, even that can, like you might not remember that because that is associated with the main traumatic event, right? And this can be for like months or years of memory as well, right? Like a lot of people might not remember their good part. Like, usually a lot of us might remember, oh, how was like, let's say primary school, right? But if a kid who has experienced, unfortunately experienced childhood sexual abuse during that time, might not remember their primary school days at all, right? So that is your localized, where the exact event and maybe also the event, other events surrounding or leading to that event or post that event, those things might be difficult to remember, or you might not remember them at all. Then we have generalized, where you don't remember anything at all, not even the non-traumatic one. So this is much more longer, where like maybe for the localized one, they might not remember some chunk of their childhood, but others, once the memories have gone deep down and have been blocked, they might remember their secondary school. But there can be some other folks, like the way their brain processes this trauma and deals with it, they might not remember. And there are people, like I get therapy clients where, when I try to take their case history or try to ask them something, they do not really have a lot to tell me. They're like, okay, I do not remember my childhood at all. Even if I ask them, okay, what was your favorite thing to do after coming back from school? Like, were there any favorite cartoons that you like to watch, or, things like that? Even the pleasant memories, which is very sad, even those they are not able to remember. So generalized is like nothing at all. Then this is another concept that is very important, dissociative fugue, right? So it is disorientation from the reality and their identity. So, sometimes you might have seen people just, walking on the road, right? Like a lot of times they're very, and you can see they are very disoriented. They could be having a psychotic episode as well, or they could be experiencing a dissociative fugue. Of course, after talking to them and giving them the care they need, you might be able to understand, okay, do we need to care for them from a psychosis perspective or dissociative? But usually, when you see people just walking around, and you can see, okay, they are having poor hygiene. They might have not like had a bath for days, or they are just wandering, and then like and of course they need to be taken care. By the way, like according to the latest, like mental health act, you can, like if you ever see a person like that just wandering aimlessly, and you can very easily make out that they are disoriented, you can always call up the police and ask them to take them to the nearest like facility. That is their duty to do that. So and that is your duty to do as well. When you see someone just disoriented, and they might be walking on the road, in the middle of the road, or they might be, I am so sorry guys, yeah, they might be walking on the middle of the road, or just like wandering aimlessly, right? So then you can help them get care. And during these times, what can also happen is they will like, let's say they have a lot of skills or a lot of talents, but because they're so disoriented from the reality, they might forget their skills or whatever talents that they have. So that is a dissociative fugue. and the symptoms cause clinically significant. So this is what we know, right? So when we're trying to think about or remember about depersonalization and derealization, the disruption is in the perception during the present time. Here, for dissociative amnesia, because amnesia is related to memory loss, the disruption is in memory. So for quickly remember like the distinguish to distinguish between these two. So disruption in the current events, that is like your depersonalization and realization, and disruption in your memory is dissociative amnesia. Yes. Okay, I know the font is quite small. Can you guys see it? I think this is sort of better. Yeah, moving on to the most like intense disorder of the dissociative disorders, right? Not that the other ones don't cause pain, it just this one is the most intense one. So there is a lot of like stigma related to dissociative identity disorder. Earlier, it used to be called multiple personality disorder, and where people had like different personalities. What was that South Indian movie? It was it Aparachit? Yeah. So they, I think, did a good job, representing like this disorder. So let me just quickly first explain, what it is. So here disruption happens. So here first we saw depersonalization and derealization, disruption in the current events or the environment around me. Dissociative amnesia is disruption in memory, and dissociative identity disorder (DID) is disruption in identity, in my identity, right? So here, basically, you have to remember that two or more distinct personality traits. The movie's Parachit. It's quite an old movie. Okay, is this? I'll just zoom in on the slide. Wait. I'm really bad with technology stuff, so just be a little patient with me. Is this better, guys? It's Aparishit. Yes, thank you, Aditi. Yeah. So this you have to remember, because a lot of times what there have been cases where like there have been people who have committed crimes, and they have like they like, because they do like consider if the person has any mental disorder, right? If that was the reason that they committed crime, then there is a different process like trial that happens for people with like mental disorders, and people who might not have a mental disorder, and they've committed the crime for whatever their personal agenda reasons, right? So there have been cases where like a person who has done a really bad thing, and they overheard the conversation between the police and the psychologist appointed by the court, where like they were saying, okay, what could be the possibilities, and then next day he started acting as a different personality. But then the psychologist of course caught it, because the like still now what has happened with DIT, there has to be two or more distinct states. It can't be like the host. So like me, right? This is me right now, Rutuja, and this I will be the host. It's called like in the terminology, it's called the host personality. That is my main, who I am. And then when I have like other personalities or other identities that get developed, right? So there should be two or more distinct personalities other than the host personality, right? So in total, minimum three, that is the host personality, my original personality, then other two distinct different personalities that are created, right? And it can be more than two as well. It can be 16, it can be 5. Do you guys know this YouTuber Anthony Padilla? He does really great. Like he has this series, A Day in a Life of, and there is one whole section dedicated to people with like mental disorders. I think that's a really great phenomenological approach to understand different disorders. You should check it out on YouTube. And yeah, so there they've talked about their experiences, so please do watch that. Bhool Bhulaiya, so that's the thing, right? Bhool Bhulaiya mein, there was the host personality and then there was the Manjalika ka personality. So there is just two personalities. So then that is not DID. That's why like it's not a good representation of DID. Because if it was like actual DID, it should have been the host Vidya Balan's the original identity character, Manjalika, and one more. Was there? I haven't watched the movie in a while. Did she also take on the personality of the lover of Manjalika, or was it just Manjalika? Yes, thank you for spelling it out, Isha. It was just Manjalika that she takes on, right? Yeah. So now I will have, yeah, sorry about that. But yeah, so if there were, so why just two? It's not that we decided, it's just that, they've observed in the cases of like DID, or earlier it used to be multiple personality disorders, it has always been that way, where minimum two other personalities. So even Karthik calling Karthik is not a good representation, because it's just him and the other Karthik, right? That's why I said Aparichit is a good representation, because there are multiple identities that are there, and not just like two, which is me, the host, and the other one. So it has to be at least minimum three in total, where one of the three is the host personality, which doesn't get counted, but I'm just talking about the, in total identities. So the host personality and minimum two other personalities. It can, of course, be more than that, right? So that is your what's I haven't watched the movie Split. I know it's like one of the movies that psychology students should watch, but I haven't watched it yet. So, but I will believe you guys, since you know now. I mean, you might have known earlier as well, but now for sure that, two or more distinct personalities minimum. So, yeah. Now, disruption in identity involves like marked discontinuity, sense of self, right? So, sense of self is gone, sense of agency is gone, because, like maybe the host personality wants to, let's say, go for my lectures, but my other personality, one of my other personalities, wants to go for a trip, right? So then when the other personality gets like, maybe we can use the word triggered, right? And then they come, like, that is the other personality is taking over my body and, like, my functioning. They will not care ke, oh, I had to go to college because I had my presentation. They will not even remember what is happening with the other identity. All they will care about, as if they are a whole different person, right? So if it's a different person, they'll look at what is important to them, or what do they want to do, right? So they will just like do those things, and they will not know okay, what is happening with other identities. That is most of the times. Sometimes, like, so some people might have insight where, they might understand that something is changing, or they might be aware about the other identities that are there. For some people, the insight can be poor, and they might not know, okay, there are other identities who are, like coming out, and they are the ones dealing with things. So it depends on person to person, how they will experience and how much insight they will have. And then, like, of course, each identity, there will be like alterations in the affect. Like one person might have, one of the identities might have, like, let's say, bipolar, others might not have that, right? Behavior, like the way of talking, the way their personalities, maybe one of the identities is very extroverted, and then, that identity will, sign you up for all these extroverted activities, group activities, meeting up, and then, when the time has come to go to those events, the other personalities are shy and introverted, right? So then that can be a difficulty. So can have like very distinct personalities, behaviors, consciousness, right? The amount of memory skills, the perception, it will be very different. And of course, like all of these things, so perception and cognition will get affected, because you don't remember anything. Like a lot of times, like, you'll not remember what your other identities have done. So, we will come to the clinical presentation of those. So there will be recurrent gaps in recall of everyday events, like, oh, when did I do this? Oh, when did I get this tattoo? Oh, how did I reach this place? I had not planned to travel, so far. Like, I was supposed to go meet my friend. Where have I come now? Right? So it could be your other identity which has made you travel to this other place, and it's very much, of course, different from ordinary forgetting. Like, you just don't show up to some vacation place without doing like rigorous like planning and all of those things, right? But that might not happen for other for like your other identities. Then we'll look at the clinical, and of course, in children, you have to make sure that this is not a part of imaginary play, right, or fantasy play, where they might like act as a different person, or they might act as their teachers, or they might act as their mothers, right? So that is just part of the play. So you have to be very careful, right, if you are diagnosing a child, which can be very rare, because one of the major reasons that DID happens again is because of trauma, right? So it is not like it can never happen. It can happen, but it will be, like, it's just saying it can be a possibility, but you have to be very, very careful, and you have to be like, is this child like engaging in fantasy play, or just doing like role play of what they see around the house, or with regards to their parents, how their parents act, or is it like just genuinely DID, right? So you have to do like proper observation. Then what will be the clinical presentation of someone who could have like DID? You can see that suddenly maybe there's a change in the way that they act or they talk, right? Maybe one identity can be like very masculine, very very confident, and the second identity could be like a little more shy, and they might not talk a lot. Then the third identity could be someone who is very flamboyant, right? So very distinct, and this will happen like it's not in the host's control. This is not in any of the identities control. It gets triggered just out of nowhere a lot of times. So they might just start talking or acting differently. They can have like so even if, let's say, the host personality is a woman, right? A woman who's, let's say, 25 years old, but the other identities can range. Like, there is no limit to like one personality can be 8 years old, another can be like a 74-year-old man, right? There have been cases where people have even like their other identities have started speaking certain languages which the host never ever like learned at all. But like somehow, that's the thing, like we're not able to understand how can this phenomenon happen, where like the other identities can come up with certain skills or certain like languages they start speaking and understanding, which the host might have never even heard of, right? There are cases where these things have happened, and that's a very important like when this happens, it's very important, because a lot of professionals, not just like lay people, but even professionals, feel that this is a fake disorder. The person might be doing it just for attention. Okay, I will come to that once I finish this. If I forget it, please remind me in the comments. We'll come to the whole attention wala bit, right? So different, like your different identities can vary in gender, age, culture, personality, the kind of skills or talents that they have, right? So that will be something like you'll notice. Yeah. Then can have insight. So some people might have insight about their alter personalities, their alter identity, and they might know about them. They might know when the switch is happening. Some might not have. So it's similar to other disorders, where like even in schizophrenia, some people have really great insight and they know, okay, this is a hallucination that is happening. It's not real. I'm having these delusions. Whereas some people might have like very weaker or poor sense of insight, where they might not realize oh, this is a delusion, like I don't have to believe it. It feels very real, but it is not real. That is not the material reality of things, right? So yeah. Similarly, here also, some people can have good insights, others might not have it. Then they might end up in a new or a different place that they might not remember traveling to, right? Like the other personality or identity takes over, and then they go to some place, and then the host personality or some other personality comes in, and they're like, oh, how did I reach here? Yeah. And then they might also end up with scars, injuries, because they might end up engaging in a lot of risky behavior, and then they might have like certain scars which they don't remember, like, oh, how did I get this wound, how did I get this cut, how did I get this injury, right? Because they don't remember the where the other where the other identities have taken over. So that's one thing. Then they will also experience dissociative fugue. So we've already discussed this. Now coming to, like, the whole if they are faking the disorder, just yeah, they're faking the disorder, right? But the thing is, and this can be like said for any other disorders as well, which sometimes some people say, oh, this person is just doing that for attention, this person is just doing that for to get like sympathy, right? Like, just assume for a minute, maybe they are doing it to get attention and they are not actually feeling those things. But then the fact that, like, what do we call it? We call it cry for help, right? So that means they do require care, they do require love, affection, compassion, and they might be requiring attention because they're having a hard time. So even if a person feels, oh, they might just be, like, they are just faking this thing, right? So it could be because, like, they just, like, a lot of times there are some kids, who might have been neglected, like, maybe they're getting neglected as a child. Like, so sadly, they feel ki, oh, I hope I get sick, or they might, intentionally injure themselves because they feel ki, okay, now my parents will look at me, right? Now my parents will give me attention. So that can be the reason. So this, with DID, there's a lot of like speculation where certain professionals do feel that, oh, this is not a real disorder. But then there have been studies where they have found, like, they have done like brain imaging, and they've seen the brain structure being different for different identities and stuff. So we have that to back it up. It's not a fake disorder. you know so yeah. And I hope the difference between schizophrenia and DID is clear. That question was asked in the beginning. Is it clear now? Schizophrenia is, you have uh, yeah, you're welcome, Kushi. And I'm so sorry about, like, professionals being this way. It's very sad. Like, yeah, it is one thing that lay people might say because they do not understand and they've not been taught about these things. But then when professionals are also insensitive, it's really hurtful. Like, then, what's the point of, even joining or, studying psychology if you're going to be mean? So it's okay, even if a person is quote unquote faking a disorder, that still means that, that person needs compassion and care. So yeah. Uh, yes. So are there any doubts? I hope the difference between DID and psychosis is very clear. DID is like, that different personalities, and in hallucinations and delusions, they're just like, um, the external stimuli might not be there, but you might feel it is there, and the delusions also, there might not be reasoning to it, right? They are not acting as different identities. It's just one person who might have delusions that, oh, I am I am the pilot of a fighter, like fighter jet, right? And the next day they'll tell you, oh, like, I am a surgeon, right? That doesn't mean that they are having, like, other things are same. When they're having, let's say, those delusions, the other things of their personality, like if the person is shy, even when they say, okay, oh, I am today, like, yeah, today you ask them, they'll say, okay, yeah, I am a pilot. Tomorrow they might say they're a surgeon, but the other aspects of the personality are intact. So the identity, when they are saying, okay, they're different, it is the delusion and not their entire core personality. They'll still be that shy person, or they'll still have, like, maybe they're soft spoken. So that way. So I hope the distinction between psychosis and DID is clear. Are there any doubts? I'll just quickly look at the comments in case I missed anything. Yeah, Anthony Padilla is the YouTuber. You should check out their series A Day in the Life of, and they've done it with very different personalities, and they've also done a whole section with mental disorders, people who have like mental disorders, which is the disorder when it's just the host personality and one other personality. So see, when like in according to DSM, right? If certain criteria is not met, but you still see something is happening, it usually comes under like unspecified. But with DID, you have to be very careful because what if that person could be faking that? Because usually in all the like cases that have been reported, or like in that we have in our literature, two or more distinct personalities is what has happened. So like the person could here be faking because they might not want to be accountable for certain things. I hope that clears your doubt. Any other questions, guys? Is it possible that people who experience depersonalization, derealization are accused of by others if it's actually gap in perception? Yeah, it can be, like forget like lying. A lot of times people, because there is a lack of awareness, lack of education, people might not even understand like what does being unreal mean, like what do you mean, like stop saying, people might use words like, stop saying stupid stuff, like what is, like what do you mean you're not real? Like people do say insensitive things, but that's not entirely their fault. I mean, they can be more compassionate, but then like people don't know what these things are, so they can be accused of being like, why are you acting weird, or why are you saying these things, like I don't think you are actually feeling this. But then that can happen with any other disorder as well. So the solution to this is having more awareness and education about mental disorders in general. So yeah, that's, I hope that answers your question, Chaitali. Oh, I think you also meant like maybe the person does not remember doing certain things and they'll be like, oh, but maybe you're just lying and you don't want to take accountability. Where, well, that can happen and that probably happens to a lot of people, but then there's no solution, like people just need to be trained to be more compassionate and, to also have the knowledge about why this person could be behaving this way. And, this might not be that the person is lying. Yeah. Okay, great. Any other questions, guys? We do have 2 minutes left before your next instructor joins. Okay, I will take that as a no then, and I will see you guys soon. Take care. Okay. Yes, thank you for the hearts, guys. Do stay on the call because your next instructor will join in and you can take that 2 minutes cup break. All right, take care.
Hello.